All right. Good evening, everybody. I'm Dr. Dane Donahue, and I'm here with my dear friends, Dr. Joe Tilley, who runs 8 Weeks to Wellness in the UK. I run 8 Weeks to Wellness here in the US. And we have the pleasure to have a man that I've known for quite some time as somebody who is extraordinary in terms of the work that he's doing. And his name is Dr. Jack Wolfson, and he's that handsome guy right in the middle that we see. So Dr. Jack, I want to welcome you to this event. This is being put on by 8 Weeks to Wellness's offices around the world. And I absolutely love this topic. It's February in the United States. We call this Heart Healthy Month. Joe, I don't know if it's Heart Healthy Month in the UK in February.
Yeah, it absolutely is. It's Valentine's, baby.
Yeah, it's got to be, right? So it's a perfect topic. Also, heart disease is still the #1 killer. I believe it's the #1 killer not only in the U.S. of men and women, but also in the UK as well. And we have the perfect person to speak to us about heart disease. And as 8 Weeks to Wellness doctors, we really believe in getting to the root cause of our patient's problem and not just continuing to treat the symptoms and the effect of their problems. And that has as much to do with pain and chiropractic and weight loss and a lot of the things that we see as it does with cardiovascular symptoms, high cholesterol and hypertension and AFib and, all the things that Dr. Jack is going to talk about. So Dr. Jack, you have a very unique background. And I know your background with your father being a medical doctor and you going through conventional training in your medical education to become a cardiologist. And then this amazing epiphany that you had. And I would dare say you're one of the few men that I know that has this unique position where not only do you really understand the innate natural healing capacity of the body and what the body requires to truly be healthy, not just to patch it up so it can survive, but you also have the background of the medical wisdom and why that's failing. So first of all, welcome. And maybe could you just give everybody a little bit of your story, your history, and so that we can get to know you a little bit better.
Yeah, sure thing, Dr. Dane and Dr. Joe. It's a pleasure to be on with the crew from 8 Weeks to Wellness. Let me just say I love everything that you guys do. And I think really that you are just the ultimate in the modern physician, is that you're able to, number one, use your hands as a doctor of chiropractic to be able to keep the body tuned up, to keep the body healthy. But then also you're doing a lot on the functional medicine side as well, and talking about nutrition and lifestyle. So it's really, you're bringing the best of all worlds together to get the best results of your patients, and you're doing lab testing, and you're really measuring outcomes, and you got all the success stories. So let me just say kudos to you. And as a guy who was trained medically, I have so much respect for what you guys are doing, because the medical model where I came from, it is all about the pharmaceuticals. It is all about surgeries. And of course, as a cardiologist, angiograms, angioplasties, stents, who do you send for surgery? And again, the pharmaceuticals. And I was trained that way, and along the way, I would meet a woman who would open up my eyes to natural health and wellness, and she is a doctor of chiropractic, DC, and she also said, DC stands for Doctor of Cause. So she said, Jack, you got to become a Doctor of Cause. And I started to listen, I started to change, and I opened up my eyes, and it's really been an amazing thing for me. And just like you said, I've seen both worlds. So I think I come at it from a very unique standpoint in the ability to really say what I think is the best approach.
So, I mean, I'm just curious that why more doctors, I guess they are starting to make this gradual transition, Dr. Jack, but you made a radical transition in terms of the way that you practice and the book that you wrote. And, I just really have tremendous amount of respect, because I think a lot of doctors that have prior, medical training, I think they kind of believe this and know this deep down in their heart, but they don't want to go to the public or don't want to go to their colleagues and say anything. So the fact that you're this guy that's out there really speaking the truth and yelling it from the mountaintops, because what we're going to talk about today really is the truth. So let's kind of dig into this. We are talking about heart health and heart disease. So can you give us a little bit of a background on heart disease, where it comes from, some of the risk factors like high cholesterol, atherosclerosis, hypertension. What do we need to know about heart disease?
Well, let me, say to the group and everyone who's listening is that there's always a cause of what the issue is. Now, the medical doctors, they really do think that the cause is genetic. They think that the cause is lack of pharmaceuticals like statin drugs or blood pressure drugs or an aspirin deficiency. It sounds unfathomable that people believe that, but I came from that space, so I know what they believe in. And now what we try and do is that we try and go after the cause. And the cause is not cholesterol. The cause is not genetics. The cause is things like poor nutrition, environmental pollutants and toxins, lack of physical activity, lack of exercise, lack of sunshine, lack of sleep. And what we need to do, of course, is to take that approach with our people and to be able to teach them what the cause is. But if you take something like coronary artery disease, once again, that's just a response by the body to what's happening to the body, to these environmental toxins and pollutants, whether it's air pollution or it's electromagnetic fields or it's pesticides in the food. It's kind of everything that leads to this overall inflammatory response. And then inflammation ultimately leads to disease. So the cardiologists typically get that there's inflammation involved, but they don't get what is the cause of the inflammation. And let me just remind you all, there's a reason why your average doctor doesn't get this. There's really kind of two fundamental reasons. Number one is that they're paid not to understand it. They're paid in an insurance-based model where they see a lot of volume of patients to not go after the cause, but to give them a quick fix and get them out of your office. And I'm telling you, I did this for 18 years, so I know the whole backstory on this. Now, the other thing also is that it is a major shock to the system of a medical doctor like myself to think that we're wrong. The whole medical system, the whole sickness model is faulty, and we have to go over to the health side, and that's where I choose to operate, and that's where the results lie.
So if I get this right, what you're saying is cardiovascular disease is just an adaptive physiology to a very unhealthy environment.
Yeah, most certainly. It's just, your body has a response to all of these factors that are coming in. I guess we can call that maybe, one person termed it a few years ago, the exposome, the exposome. And the exposome are all these environmental toxins and pollutants that are coming from the food and the environment, and of course, poor sleep and lack of sunshine, and all these factors lead to the body to become irritated and inflamed. And once all that is going on and the immune system kicks in, ultimately you have the disease. And there's a way to fix that. There's a way, ladies and gentlemen, to get off of your pharmaceuticals, because if we remove the cause of the high blood pressure normalizes. If we remove the cause of blockages, the blockages will start to clear themselves.
That's awesome. So I loved in your book where you actually cited studies that there's really no data that suggests that there's any correlation between longevity and low cholesterol. As a matter of fact, it's just the opposite. And
yeah, obviously cholesterol is vilified by mainstream media, by pharmaceutical companies, and of course by the doctors that get trained by the pharmaceutical companies. Essentially, medical education is controlled by pharmaceutical companies. But either way, we want people to understand, and that's why I put that in chapter 1 of my book, The Truth About Cholesterol, and Cholesterol is King, is that cholesterol does have a purpose. And what we found from the Mr. Fit trial in the 1970s, and even from Framingham data back into the 1950s, is that people with ultra high cholesterol, that's not a good thing. People with ultra low cholesterol, that's also not a good thing. And the risk of dying goes up when you kind of get on those extremes. But there's a sweet spot of total cholesterol between 160 and 260. And that is the sweet spot when it comes to how long we live or die. So we want to get people on the right nutrition plan, on the right lifestyle, under chiropractic care. And that's how we're going to get that sweet spot of total cholesterol.
So when I had a patient last week whose cholesterol was 203 and his doctor told him that he had to get on statins, he's in the sweet spot. He's not even close to being in the very high range.
Well, no, he's not close at all. And unfortunately is that the only response that a medical doctor has these days is to recommend the pharmaceuticals. The medical doctors are not trained in nutrition. They're not trained in lifestyle. They're certainly not trained in physical medicine and chiropractic care. So they're going to always default to the only thing they could do in that real short office visit. Even if they did understand nutrition and lifestyle, they have no time to discuss it. And that is really a problem with the medical model as it exists. Now, when you go to a doctor in 8 Weeks to Wellness, they take the time to explain all this to you because they understand it, and they've created a model where they can explain this. So if you're looking to really make an impact on your health, I can only tell you, you got to opt out of the conventional medical system, and you got to get over to a holistic doctor.
Yeah.
So obviously, Jack, one of the most well-used medications for cholesterol issues is the statin. And one of the questions we got from our clients is, what are the actual side effects of taking statins long-term?
Well, there's really not a lot of data regarding long-term follow-up on pretty much anything. It's just, the pharmaceutical industry, they're responsible for testing early on, and then they're pretty much good to go. But we've seen plenty of people with cognitive brain issues related to statin use. In fact, there's a famous medical doctor who is now deceased in his late 80s. His name is Dwayne Graveline, and he was a NASA astronaut, and then he became a medical doctor. So let's just say he's a pretty smart dude. And he wrote a book called Lipitor, Thief of Memory. And it basically documented all the different cases and all the literature and all the research that says that statin drugs inhibit brain function. And I've seen many, many, many patients like that. So we've got brain, we've got liver, and then of course, classically, it was muscle damage. So much so that there was actually a pharmaceutical from years back that was called Baycol. And Dr. Dane, you probably remember Baycol or Ceruvastatin. And that particular statin was actually withdrawn by the FDA after at least 50 people died of muscle damage from that particular statin drug called Baycol. You can Google it and you'll see it right there. I mean, that drug was pulled. So the other drugs maybe not quite as extreme or as overtly dangerous, but like we said, liver, muscle, brain. The problem is that you're removing all the cholesterol from the body, yet as we explain, cholesterol is necessary for the body. So when you remove it, the body cannot get the job done.
Well, I love it in your book how you say cholesterol is the boogeyman, because, the one number, if you ask somebody, what is your cholesterol number, everybody knows what their cholesterol number is. And, cholesterol is really vilified. We want to get our cholesterol number as low as we possibly can. Can you maybe talk about the difference between the quantity of the cholesterol that you have and maybe talk about where cholesterol comes from? Because, if I'm right, the liver makes most of the cholesterol for our body. We do ingest some saturated fat and cholesterol in our diet. But maybe talk about the difference between quality of cholesterol and quantity of cholesterol.
Yeah, most certainly. Cholesterol is a small waxy-like molecule that is involved in all cellular functions. All cells have cholesterol in the cell fence called the cell membrane that's responsible for keeping things inside the cell that belong and keeping out things outside of the cell that don't belong. So the way cells communicate with each other has to do with cholesterol. The way hormones, estrogen, progesterone, testosterone, the way they interact with cells depend on cholesterol. Our digestion in the form of bile is cholesterol. Vitamin D comes from cholesterol. As we said, the aforementioned sex hormones, testosterone, estrogen, progesterone, pregnenolone, and cortisol itself for energy and for stamina, all those kind of things. That all comes from cholesterol. So we cannot live without cholesterol. Now, when you get to the kind of the bad and the good type thing, that's where we start talking about things like LDL, and LDL has often been termed the bad cholesterol, and HDL is the good. But that is such, not only is that simplistic, but it's not even true, because all mammals on planet Earth make LDL, and they do so for a reason. So I think, Dr. Dane and Dr. Joe, what we're talking about is let's give people the optimal plan to find the perfect cholesterol and LDL and HDL for them. And the closer you follow that plan, the better off your numbers are going to look and the longer you're going to live.
So let me ask you this. Should people get their cholesterol numbers and their LDLs and HDLs and their subfractions, should they get these tests done?
Well, I think what you just said there is the answer is I don't really care at this point in time what their total cholesterol is, and neither should you, because we just said it really doesn't matter in the spectrum of who lives and who doesn't. What matters in the most advanced testing and what really is most predictive is, as you said, it's the particle numbers and the particle sizes. That's where we can really determine, hey, LDL, there are some good LDLs, which is why all mammals make LDL, and there are some bad and dangerous LDLs, and we need to know what we have. Do we have a lot of the good ones and very few bad ones? That's a good thing. And the same thing with HDL as well, is that we want to know HDL particle number, and that can give us a lot more information than what I call the standard 1970s testing of total cholesterol, total HDL, total LDL, and triglycerides. And your medical doctor, on average, is not going to do it unless you really ask them. Yet when you go to the 8 weeks to wellness doctor, that's just part of the program. Right. And that's the beauty of it, is to, me as a cardiologist, knowing that the 8 weeks to wellness doctors are doing more advanced testing than the cardiologists.
Yeah. Well, one of the things, and this is from a study, and I'm sure you could cite the study, but when I first started 8 weeks to wellness 15 years ago, subfraction testing, like testing particle density and size of HDL and LDL, wasn't very popular. But we used a surrogate marker, triglyceride to HDL ratio, which is 17 times more sensitive to whether somebody is going to have a cardiovascular event than just looking at total cholesterol. And it was amazing how predictive that was of a person's health. When their triglycerides were really elevated and their HDL was really in the tank, that was a person that really was set up for a cardiovascular event. Now we've had this new technology where we can look at these subfractions. But at the end of the day, what you're saying is it all comes back to changing your lifestyle, because if you change your lifestyle, you're going to change your cholesterol, not only quantity, to your ideal, what your body needs, because we all need something different, right? But also the quality of that cholesterol.
Yeah, and I think, to your point, that we can all say, you know what, I'm just going to follow the plan. I'm going to eat the right foods. I'm going to live the right lifestyle. I'm going to do all those things, and things are going to work out. And that may be true, but that is the beauty of doing the testing, is that it really gives affirmation of where we're at, right? So, 8 weeks to wellness, of course, is classic, is that, you test at time 0, and then you test 8 weeks later, and you see all the benefits. And obviously, I know you guys have got, hundreds of cases that you can talk about where that, plan does work. So it is nice to get that verification just to make sure. And I think also is that the lab testing kind of helps get you back on the right track. This time of year, the holiday season, was so, close behind us, but the reality is it's not that close. It's already at 6 weeks. It's 8 weeks ago. It's time to move on. The holidays are over. It's time to get healthy. And then when you plug in to 8 weeks to wellness, or when you at the very least get tested, see where your numbers are now, get on track, test them 8 weeks down the road, and you'll be amazed.
So Jack, I always like to say, it's not what you know that hurts you. It's what you think you know that isn't true. And so many people are told by their cardiologist that saturated fat is the devil. You shouldn't be eating eggs. It causes cardiovascular disease. So what's your information for our clients on saturated fat? I know your book really explains a lot about fats and how we should be changing our diet to help with cardiovascular disease. But what's your take on the saturated fat debate?
Well, there's a lot in the literature, obviously, that really speaks against what you just said as far as saturated fat being dangerous. Saturated fat is not the problem. Coconut is kind of put up as the poster child of saturated fat, yet people in the South Pacific, 50 to 60% of their diet is coconut based, and they live very well despite the fact that they all smoke. So I'm not going to sit here and condone smoking, but what we're going to say is that saturated fat is not the problem. And saturated fat, when it's balanced with some of the polyunsaturated fats, of course, the omega-3s, especially when it's coming from seafood, a lower intake of omega-6s that are some of those plant-based oils. We're going to avoid, whether it's soy and corn and canola, and we're going to stick, once again, saturated fat, the omega-3 fats. Those are a good place. And then, of course, monounsaturated fats like olive oil. And I think that the real villain in this story is obviously pesticides and chemicals in the food, artificial ingredients and colors and flavors in the food, and of course, sugar and the refined carbohydrates. That's clearly the villain in this story. Right. But unfortunately, most people don't want to hear that. They want to blame it on saturated fat, thinking, well, I can just avoid saturated fat while I have all these sugars because sugar is so addictive. But finally, let me say this, is that the more saturated fat you consume, the higher your HDL. And we just have been talking about the importance of raising your HDL, about the importance of increasing apolipoprotein A, as opposed to the apolipoprotein Bs that are found on LDLs. So what we want to do is, once again, if we're eating per Mother Nature, just eat with nature, and you'll do very well.
And there, I guess and you probably saw this quite a bit, in your travels through hospitals, but it seems like we always segmented the diabetic patients and the cardiovascular patients. And now we're starting to see that the diabetics are the cardiovascular patients and vice versa. Can you explain that in terms of how sugar affects, how sugar causes heart disease? Because I don't think people really understand the why behind that mechanism.
Well, I guess it's really a long answer, but let me just say, one thing that elevated sugar does is that it damages all the proteins of the body. So one thing we measure to look at long-term blood sugar control is hemoglobin A1C. And what we're measuring there is the amount of damage done to the hemoglobin protein. And that we use as a surrogate to say that there's poor blood pressure, poor blood sugar control. But now we've got those damaged proteins, and now they don't work. So when proteins don't work in the body and the enzymes don't work, well, of course, you're going to be sick. In addition, when there is elevated insulin we think of as a storage form, as a hormone that helps us store glucose, which is true, but it also helps us store fat. So if insulin levels are high, you cannot break down fat. Fat just gets socked up, up into fat tissues and adipose tissue and fat cells, and you can't release them. And then also, let me say one more thing about insulin, is that insulin stimulates the HMG-CoA reductase enzyme to make a lot more cholesterol. So insulin stimulates all of that excess cholesterol production, which is a problem. So when you keep your insulin levels low, you don't make as much cholesterol. And then finally, when it comes to clearing cholesterol as LDL from the body, when you have a lot of insulin that's there, the liver does not clear out that old LDL. So as you asked, there's a lot of different problems with sugar and carb consumption, and even excess fruit consumption as well, we got to be careful with.
So let's say that somebody's sitting in the audience right now, Dr. Jack, and they're like, you know what, I've been taking these statins too long. My gut's telling me I don't really need to be on these. I don't want to be on these, but my doctor, is putting the pressure, and how it goes. The doctors put the pressure on the patients that you can't get off of this. They use the fear factor of, your dad died of a heart attack, you have heart disease, you're taking your life into your own hand if you get off these statins. But if somebody really feels that they want to get off statins, what's the best way to go about, getting off a statin properly and making sure? I always say, Dr. Jack, you can't have it both ways. You can't be eating like a slob, right? And eating a lot of sugar and a lot of toxic food and a lot of processed food and, eating not the 8 weeks to wellness way, and then get off your statin, right? There's a reason your doctor put you on it, and he did it with the best of intention. But if you're really willing to do the work, which is to change your diet and start exercising, what's the best way to go about getting off a statin?
Well, listen, this is not the 1970s where what the doctor says is gospel. We have the ability to really to make our own educated decisions now. And I would encourage anyone who's listening to make their own decision. You go to your doctor and tell them what you want the plan to be, that you want to give this 8 Weeks to Wellness program a chance. You want to give a holistic approach a chance, and you want to stop the pharmaceutical, and we're going to get tested at time 0 and then test a few months down the road. But what we're not going to do is that we're not going to think that we can necessarily do as well as statins as lowering the numbers down. That's not the goal. The goal is to find the perfect cholesterol, LDL, HDL, triglyceride for you. And the more you follow the plan of 8 Weeks to Wellness, the better off you're going to be. But Dr. Dane and Dr. Joe, we know that their model is a failure. And I say that because when you're on statin drugs, for the most amount of people, your risk of having a heart attack, for example, goes from here down to here. The changes are a percentage, maybe a 1.5. We're not about lowering risk from here to here. We want to lower the risk down to 0. They can't do that. We know their data. We know how bad they do. And that's even on people that are eating horrible diets that are included in those studies. So if you're going to have if you're going to say, you know what, I want to continue to eat the way I'm going to eat, just understand that the drug, although it dramatically lowers your numbers down, it barely moves the needle to lower your risk down. If you really want to lower your risk, follow the model of 8 Weeks to Wellness.
So let me ask you this. You could only take 3 supplements for the rest of your life for heart health. What 3 would they be?
Well, I'm a big supplements guy, so that's a really tough question for me.
That's why I said 3. You and I both take, and Joe does too. I take fistfuls of supplements.
Well, listen, obviously is that it's very difficult these days to get all the nutrients from your food. You pretty much can't. Cauliflower and broccoli that were grown in Asia, now they're grown in California for so many people. And the soil is different, the air is different, the water is different, pollution is an issue. All these things, play a factor. And that's why we do testing on people to see what their deficiencies are. But at the end of the day, if you're going to ask me that, back to the original question you asked, I would be on a probiotic. I would be on a multivitamin, and the average person, I would be on a digestive enzyme. Those are the things I would be on. I do love the ability. There's plenty of supplements that can help assist your cholesterol. There's plenty of supplements that can help assist your blood pressure and your thyroid and your blood sugar. There's a lot of different options. And obviously when you speak to your 8 Weeks to Wellness doctor, you're going to hear what those alternatives are. And to me, those alternatives always beat the pharmaceutical industry.
Could you give us the top 3 supplements for blood pressure and the top 3 for cholesterol, Jack?
Yeah, no, sure. Some of my favorites for blood pressure, I'm going to give you 4, Dr. Joe.
Sure.
I'm going to give you the bonus, the 4th one here. So what we're going to say is I love doing an organic beetroot powder. Beetroots open up blood vessels by increasing nitric oxide. And there's another pathway to do that, and that's through amino acids, specifically things like L-arginine, L-citrulline, L-taurine, that can crank up nitric oxide. And I like to tell people, drink that combination in the sunshine, because the sun also increases nitric oxide. And as I said before, by the way, sunshine lowers cholesterol by converting it into vitamin D. So I also am a big fan of magnesium supplementation, and I'm a big fan of potassium supplementation as well. So kind of like that's the 4 main things, although there's many others we can do, but that's a pretty good start as far as those 4. Regarding cholesterol modification, a lot of good things that we can do there as far as supplements are concerned. I'm a big fan of berberine, B-E-R-B-E-R-I-N-E. It's been studied by the Chinese for 75 years. It comes from a plant, very effective as far as cholesterol and lipid control. I'm also a fan of things that bind up some of the excess cholesterol in the gut. And there's pharmaceuticals that do that, but then there's also natural ways. And one of my favorite is like an organic psyllium husk powder that would do so. And then third thing in that realm You can do curcumin would be fantastic for lipid reduction and modification. You can do spirulina is one of my favorites. Spirulina, the evidence shows that total cholesterol reduction by 47 points. LDLs are reduced by over 40 points, and HDL goes up. So there's a lot of different things we can do naturally. We don't need the pharmaceuticals. And once again, I think the supplements help to supplement the healthy lifestyle. So by eating the food, by getting away from the chemicals, by getting the sleep, getting the sun, and this is all evidence-based, guys, right? I mean, I've got over 300 references in my book that speak to the original literature and the studies that, you know, that agree with what I'm saying and support what, you know, what we're doing.
If you had in your, and I want to talk about your book in just a second, but you know, there's so many different types of eating plans, nutrition plans, diets, whatever you want. Low fat. But if you had to put a label on yours, you know, is it ketogenic? Is it paleo? Is it low fat? I know it's not low fat because I just know you, but how would you describe your eating program that you recommend and advocate to your patients?
Well, you know, I am the paleo cardiologist. My patients kind of named me that. I think originally it was the caveman cardiologist. Then we got to the paleo cardiologist. And of course, I titled my book that. And paleo, you know, really, you know, because people will say, oh, paleo is a fad and all these other diets. You know, paleo by definition is not a fad. Paleo means old Stone Age. So when you're following the old Stone Age diet, there's no fad. And what we tell people is, by following the wisdom of our ancestors, the hunter-gatherer diet, and bringing it to the 21st century, that's how we get the best results. The fad diets are low fat. The fad diets are, you know, South Beach diet. Those are the fads. You know, veganism is a fad. Vegetarianism is a fad. Our ancestors were paleo, and we should be as well. It's very well documented. But I do say, whatever diet you follow, please make it organic. Get the chemicals out of your food. Free-range grass-fed meats, wild seafood, and then everything else is going to be organic. And if you do everything organically, Dr. Dane, Dr. Joe, I mean, even if your vice is ice cream on Sunday nights, then go get organic ice cream or get organic dark chocolate, get organic coffee, get organic alcohol. And the good news is it's all available out there for you, but low fat is very damaging, very ravaging. I am a higher fat guy. Obviously, the main diet right now that so many people are talking about that's all a buzz is keto. And I think that keto has value, and it kind of falls under the paleo umbrella. So paleo can either be a higher carb or it can be a higher fat version. And if you go paleo high fat, well, then you will go into ketosis. The difference between keto as it's taught now and true paleo is that keto would allow for dairy and true paleo does not. And I think also is that a matter of, you know, two things. Number one, how do you feel on that diet? Number two, how does your blood test look?
So one of the things actually, Jack, that I love in your book while we're talking about paleo is the food pyramid that you have within your book, the one that you created. That really resonates with me, and we eat that way, and I just feel fantastic on it. But can you just explain a little bit more about that food pyramid and what you really should be at, what should be at the bottom, what should be at the top?
Yeah, you know, so many people these days, they're kind of going after this, the plant-based, you know, diet. And I say, well, hey, listen, here's our paleo pyramid, and it is plant-based because plants are on the bottom, and then you can decide as you go up from there, is it going to be more nuts and seeds and avocados and coconuts, or is it going to be more towards the meat seafood side? And I think it's kind of seasonal. I think it's kind of up to you what you want to do from there. But there are actual paleo peoples that the 2/3 of their diet was animal based. So it speaks to the fact that animal proteins should be at the bottom. But I think, you know, really it's kind of like whatever resonates with you on that pyramid. And then you can decide whether, you know, it's seasonal, you know, where you want to go. But the kicker is over there on the left side of that pyramid. It was free range, grass fed, organic, trying to do local whenever possible. Thank you for pulling that up. I mean, but,
sure.
You know, that's pretty much what we're looking at is we're looking at following the foods that are on here. And then also, you know, incorporating organ meats, incorporating a lot of spices, incorporating fermented foods into the
Yeah.
diet. But this is pretty a staple. What you do not find on here, grain is not on here. Sugar outside of fruit and a little bit of honey is not on here. Nothing artificial, no chemicals, no artificial sweeteners. None of that stuff is on there either. So
I think one thing for me with this food pyramid as well is how you kind of have the fruits in season on the top. And if we take ourselves back to when we were hunter-gatherers, we didn't have fruit access all year round. And now we can take, lots of fruit, lots of fructose any time of the day. And sometimes I see people winding up with obesity and overweight issues because they are having way too much fruit still in their diet. So I think that was a really important thing for me with this. One other question I had, and one thing I get a lot from people, is that porridge oats have been shown to reduce cholesterol. Now, I understand cholesterol isn't the boogeyman, but people have been told that oats are good because they can lower cholesterol. And obviously, oats aren't typically a paleo food. So what's your take on that?
Yeah, I think oatmeal is garbage. I think you can actually eat the box.
Yeah.
And
sure.
You will lower your cholesterol as well, because cholesterol will be bound up in the gut from the box, from all that fiber and message. And the box is probably cheaper than the actual product. And the box doesn't spike your blood sugar like oatmeal does. So oatmeal is not paleo food. It's not ancestral. It doesn't belong in our diet. But I mean, let me say this while we're talking here is that, my lineage is Russian, Polish. Dr. Dane, I know that you are of Irish descent, and Dr. Joe, let's just say, you've got 1,000 years of people living in the UK. I don't know. But let's just say that, once again, for the entire winter time, you weren't having salads. You weren't having broccoli and cauliflower and dandelion greens. For several months out of the year, you were subsisting on animal products and potatoes and things that would be able to be stored for a while. So I do think there is that seasonal variation, and I wouldn't discount that method actually of kind of veering more towards animal products and the seafood in the winter time, and then in the summertime enjoying some of those more along the fruits and the vegetables side. But that may be getting a little more advanced to people, but I think once again, ultimately stay in the pyramid and you'll be in good shape.
So let's we'll start to wrap this up, and I would encourage all the doctors to really have a discussion. Maybe there's further questions that people in the audience have that you can help them address. But I also want to direct people to Dr. Wolfson's website. I do know I've met his whole family. He just has a beautiful family. But this is his website. It's the doctorswolfson.com. The very first time that I learned about Dr. Jack was I read his book, and I was absolutely blown away. I couldn't fathom that this book was written by a medical doctor. I wanted to go find him and kiss him, because I'm a third-generation chiropractor, and I thought this book was written by a chiropractor, and lo and behold, it was written by a medical doctor. But when I learned of this story, I was really just I've just felt blessed that we had this man in our profession, really helping to educate the public, because I do believe that Dr. Jack is a figure that's really making a difference because of the clout that he carries because of his background. So. I would encourage everybody to, I know in our office, you're going to get a copy of the book, but I would encourage, if you have not read Dr. Jack's book, The Paleo Cardiologist, he touches on everything we've talked about today, and then probably 200 things that we haven't touched on, everything from exercise to chiropractic care to nutrition and to cholesterol and all of these things. So I would highly encourage everybody to make sure you get that book. Make sure you visit Dr. Wolfson's website. Stay in touch with him on Facebook. This is the type of man that you really want to stay connected with, because learning is remembering. And it's hard to remember, every single month. But if you're getting a little snippet from Dr. Jack, and what's the best way to do that, Dr. Jack? Is there a way that people can stay in touch with you?
Well, they can, come onto the website and sign up for some of our stuff at the doctorswolfson.com, and of course, social media. I do want to tell everybody, I do have the podcast called The Healthy Heart Show. That's been out for a few months, and that's been fantastic. And Dr. Dane, you've been featured on the show, and I got to get Dr. Joe on there as well. No, I appreciate that. And as long as we're talking about, giving each other kisses and stuff like that, I think it is a very important point to let people know that mental health is extremely important as it pertains to all health in general, but certainly cardiovascular health. So much so, that's why I wrote a chapter called One Nation Under Prozac. But I want to make sure that everybody, we try and get the stress out of our lives, the anger out of our lives, the depression out of our lives, and bring love into our lives. So maybe Dr. Dane, in lieu of that kiss, we just give each other a hug, next time, and that connection and that love that we all feel with each other, that feeling of connectedness is as important as diet and sun and sleep and the chiropractic adjustment. It's all part of the plan. And that's the beauty of it, guys, right? We've got this whole grand plan that can really make a difference in people's lives.
I read one time that we need 14, the RDA of human connection, hugs, kisses, affectionate touches, is 14 a day. You need 14 hugs, kisses, rubs, whatever. But that's what I try to get at least every day. And I'm an overachiever, so I try to get like 20.
I always say to my clients, and this is true for all of us here, we're huggers, not druggers, eh?
Yeah, no, for sure. And I think, also, Dr. Dane, congratulations on you guys getting a new dog. And really that highlights the fact that dog owners tend to be much healthier than people who do not own dogs or other pets, because that connection you have with another living being just does so much, whether mental and actual, the physical, and that feeling of connectedness. So I certainly recommend that as well.
Well, the dog's running me at about 30 miles an hour, so it's very good for my heart health. So. All right, so we'll wrap it up, guys. So I hope you guys really enjoyed it. And Dr. Jack, I can't thank you enough for, again, all you do, but really your affiliation with 8 Weeks to Wellness has been invaluable for our clients and for our doctors, and we just appreciate everything you do.
Thank you. Thank you both.
Thank you.